Hi there, you're welcome to Damiaric's Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts whenever we post our other educating videos and also be able to help support our community here at Damiaric's Care. So let's dive right into the topic of choice today. So our medication of choice is gabapentin. So gabapentin is usually used for nerve pain, also known as neuralgia. It can also be used for seizures as well as fibromyalgia, and also something they call diabetic neuropathy, which is a condition that's common in our diabetic patients when they start to have nerve damage. And also this medication can be used for general nerve related pain. So usually patients will be on a 300 milligram to about a 600 milligram tablet a day. Usually this medication comes in about 300, 600, and also I believe 800 milligram tablet. All right, so this medication usually comes as an oral capsule, liquid tablet that patient can take much easily as well. So what are some of the side effects that you want to know about while taking this medication? So one of the major side effects of this medication is dizziness. So you want to make sure that you're taking this medication while you're not operating any machinery that requires you to be mentally alert. So this medication can make you very drowsy and dizzy, and you want to make sure that you're taking precautions while taking this medication. Another common side effect is lower extremity swelling, which is also known as peripheral edema. So patients normally notice after taking this medication for quite a period of time that they get swelling in their feet and maybe also in their arm as well. So make sure that you're looking out for that. If you start noticing this issue or side effect and it becomes very bothersome, make sure that you reach out to your doctor. That way they can try to substitute the medication for another one that doesn't have that side effect. All right, so another common side effect of this medication is sleepiness. So the medication usually make the person drowsy and dizzy and also make you sleepy as well. So like I said earlier, make sure that you're not doing anything that requires you to be mentally alert. That way this medication doesn't affect any functions. All right, so another side effect of this medication is decreased breathing. So you want to make sure that you're taking the medication as prescribed. That way you don't have an abnormal decreased breathing. We could actually lead to another condition or a serious condition that requires an urgent care. All right, so another side effect of this medication is fatigue or tiredness. So like I said, make sure you're aware of this side effect. This side effect may be subjective and it might not happen to everyone, but just in case if it does, this is a side effect to kind of look out for while you're on the medication. Some serious side effects of the medication are skin rash, which could be a sign of an allergic reaction. So make sure you're reaching out to your doctor if you're having this side effect. That way they can kind of assess you and make sure it is not a side effect or a serious side effect from the medication. Another serious side effect to look out for would be a bloody urine as well as an unusual mood changes. And if this start occurring or you start developing suicidal thoughts while taking this medication, make sure you reach out to your doctor immediately. That way they can assess and make sure that this is not a side effect from the medication and treat you accordingly. All right, so what are other things that you want to know about this medication? So you want to make sure that you're swallowing this capsule as a whole. This medication is not a medication you want to chew, crush, or open the capsule. You want to swallow the medication as a whole with a glass of water in order to help the medication perform its function accordingly. So if you do want to open the capsule, if you're not able to swallow, then you want to make sure you empty the capsule content inside a tablespoon of applesauce and make sure you swallow that immediately. That way you're not letting the medication be affected by the content that you're mixing it with. Also, you want to make sure that you're taking this medication with a full glass of water and making sure that you can take it with or without meals. So this medication is not meal dependent, so you can either take it after eating or before you have your daily meals. All right, I hope I was able to help in terms of letting you know what's and what not to look out for when you're on this medication. If you did enjoy this video, make sure you hit the like and subscribe button down below and make sure you're here to support us here at Damiaric's Care Community. Thank you and stay blessed.